Christian, with Central Health. Welcome to this community conversation. This is our third community conversation in a series of conversations that we've been having for the past couple of weeks on Central Health's fiscal year 24 budget and tax rate. We are broadcasting this meeting on Facebook Live, so for people who are watching virtually, they're invited to submit questions online, and we will try to answer those questions during this meeting as well. It is a conversation, so we really invite you to share your thoughts, your ideas, your questions. We are limited to one mic, so I'll play, let's say Oprah, and I'll take the mic around the room to share it with you so everybody here and via Facebook Live can hear your questions. We have a public meeting this Wednesday at Central Health's Cesar Chavez office at our Board of Managers meeting. Everybody is welcome to join that meeting either in person or virtually to provide comments to our Board of Managers. Then in early September, and I have my notes in front of me, the exact date, early September, our board will vote on our tax rate and budget, and then Travis County Commissioners vote on our budget and tax rate. Ultimately, Travis County Commissioners will approve our budget. So with that, anybody have any questions before we get started about the format of this morning's meeting? And as always, if you need to step outside or you want to grab a breakfast, taco, or coffee, please do. This is a very informal and casual conversation. Cynthia, Manager Valadez.
I just wanted to know whether we could darken the room so that people can see the screen better. That's all.
That would be a yes. Okay. With that, let me introduce my colleagues first. The CEO of Central Health, Mike Giesland, and then two of my colleagues that will be our panelists for today. Kim Johnson is a budget and financial analyst. Kim, raise your hand, here at Central Health. And Cynthia Gallegos, she is our Vice President of Operations. So these are the experts that will answer any and all of your questions, right? Again, Mike Giesland.
So good morning and welcome all, and thank you to our interpreters this morning for being able to include people in the conversation, and thank you to those of you, that are joining us online here for this Facebook Live event. Here at Southeast Health and Wellness Center, if you look at the neighborhood surrounding where we are today, going over to I-35 and coming over to 183, going down and picking up areas in Del Valle, and of course, this neighborhood here, at any given time, on average, we have anywhere between 12 and 13,000 individuals enrolled in the medical access program. Predominantly Latino, predominantly Spanish speaking, but I point that out because if you think about where we are today, and many of you were involved in helping to make this center what it is. Manager Valadez, who's currently on our board, but was very active at the time that Southeast Health and Wellness Center came about. And others, if you're here, raise your hand if you were part of those community conversations and groups. Thank you. Crescencia, Ophelia, thank you. What it's all about is creating places of care that are affirming, that meet people where they are. But also at Central Health, and we'll talk a little bit about this later on, if you can't get here, we can help arrange transportation. Or if you can't get here through the transportation that we arrange, we meet you where you are with our street medicine teams. So the point is this, however you identify, that is important to us. We care, we embrace that. We embrace you. And we want to make sure that we're delivering the highest and best possible quality of care, not two standard or two systems of care, one for low income and one for everybody else, but one, so that people can live the healthiest life possible. If nothing else resonates today or anything on these slides appeals to you, please remember that. It's the highest possible quality of care so people can live the best life possible. That matters to us. So with that, let's go through a couple of slides here, and then I'll hand it over. Next slide, please. A few things about Central Health. We are growing quickly. You'll see in subsequent slides, we're adding more employees. We're adding more lines and more services of care. Sometimes we say line of care. Think of that as our line of service. That's just a bunch of jargon, but think of it as a type of care that we're providing. So rheumatology, primary care, certain subspecialties of care, transitions of care, those that are transitioning out of the hospital. So we're not just growing quickly in terms of staff, we're growing quickly because we are providing more and for more people. We're making major investments in healthcare equity. Our healthcare equity implementation, our action plan that was ratified by the board, is a 7-year blueprint that has over 150 initiatives in it so that everybody, not just me or Cynthia or Ted or anybody, but everybody can follow along to see what it is that we're doing. And that's important to us for transparency purposes. And realizing things may change in between now and even next year, having some idea about where we're going is important for the public so that your tax dollars, you can see how your tax dollars are being spent. And we're already providing better health care. So everything that we're going to be talking about today is not just a dream. It is, in fact, a vision, but it is actually happening today as we speak. And so we have medical respite care. So if you're at a place where you don't have a safe place to convalesce and to heal after you've been discharged from the hospital or perhaps a skilled nursing facility, especially if you're experiencing homelessness or you're unhoused, we currently have projects today where we can provide you with respite care, but we're going to expand that. We have specialty care that we're bringing online. Cardiology, help me out with the different ologies, and the iatries. Podiatry, gastroenterology or GI, neurology and nephrology. And these are all important because individuals, while we want to really maximize or optimize that primary care relationship, and we're fortunate to partner with community care here at the Southeast Health and Wellness Center to be able to do just that. Sometimes you need a specialist. And so we want to make sure that your primary care docs or your primary care team has somebody to refer you to so that you can get the care that you deserve. And then you'll also see, you saw one visual as we opened the slide, as we opened this presentation. We are bringing online new clinics at Hornsby Bend and Del Valley, and we hope to get the preliminary started as quickly as possible on Colony Park, not to mention the specialty care clinic that we're building out at Rosewood Zaragoza. We're going to start that out at East Austin first and then transition it over to Rosewood Zaragoza. So there's a lot of different places where you can go and literally put your hand on a wall and see the investments of your tax dollars and places where people can come to, again, live that healthiest life possible. Next slide, please. So we were created in 2004. Now, we are growing quickly, and we're doing a lot. But it's not like we've just made this up out of whole cloth or overnight. A lot of this has been happening and has been in the works for a long time, and I want to thank our current board. I want to thank prior boards, staff that have been here with us longer than they really want to admit that they've been here, as well as new staff. Everything that we've been doing and working with community advocates and patient advocates and community advisory groups has been leading up to this point. Next slide, please. So who are we privileged to serve? All in all, throughout the Central Health enterprise, which is ourselves, community care, health centers, Sendero health plans, we're able to serve 152,000 patients. 122,000 have been covered by the medical access programs or through Sendero health plans, also known as Ideal Care. And we do this at over 220 provider locations around Travis County, including right here at Southeast Health and Wellness. We are predominantly people of color that we are privileged to serve. We are linguistically diverse, 52% speaking Spanish, and as gender identity, 54% female. So this gives you some idea about who we are. We have a lot more demographics that are available, and we can talk more about it in our demographic report, but just wanted to give you a sense about who it is that we're privileged to serve. Next slide, please. Now we get into some really nice artwork up here on the wall, and if you're watching on the slides on Facebook Live, what this shows you is over time, going back to 2016, you can see there's an increase in primary care visits. and looking and projecting out to 2025, which will be next year. So everything we're doing in this coming year is going to lead to the next year's. Our board thinks in advance like that, and we're thankful for that. You can see there's over 620,000 individuals, primary care visits. 620,000 primary care visits. That's a lot, and that includes wellness visit, it includes a visit if you're sick, it's dental, and it's other encounters. So for example, you come in and you get labs associated with your primary care visit. So that's a lot. And that number right there that you see on this top graph, that line going up, that drives everything else. It's the amount of specialty care that we need, the amount of social work and community health workers, Crescentia, that we need to be able to support patients. So it's not just about what happens in the four walls of the exam room or within a hospital surgical suite. It's everything that happens in between all of those care encounters that we are funding to make sure that people are taken care of. And so that's the important part about that top line. It drives everything else that we do. The next graph down here is the number of patients that we've received, a 27% increase, 27% increase from 2016 to 2025. That's significant. And again, as you can see, providing more care to more people, that's the essence of this slide right here. That's what it tells us. Next slide, please. So here's where I'm going to hand it off, I believe. And just let me say, as a matter of personal privilege, there are so many of you here in this room. Some I haven't seen since, even post-pandemic, we're still getting caught up with each other. But I'm so thankful for the advice, the encouragement, and what I thought has been fair, constructive criticism over the years. Maria and Ophelia, I'd never forget that time we met at the Denny's over coffee, and you all showed up with a list full of things to talk about. But I walked away much wiser for the time. And I'm personally grateful for what you've done for me personally and professionally. With that, I'll turn it over. Thank you.
Hello. So all of the details that Mike talked about, growing, changing, all of that is going to be incorporated in our budget this year. You can see we're increasing our FTEs significantly. We are increasing our expenses as well. We anticipate bringing on more staff to support our specialty care lines of service, and providing more in our contracted healthcare services as well. Overall, this budget is about expanding what Central Health currently offers. Next slide, please. So, in order to do that, we are recommending an increase over the no new revenue rate of 6.5% on the property taxes. So what that means is the same revenue that we got last year, we anticipate setting a tax rate that'll get us 6.5% more in order to support all this growth and change. And what this graph is showing is an average homestead increasing at the 10% maximum year over year, what the historical change in our Central Health tax rate has been to that homestead. And one thing that you'll note is that the tax rate actually decreased last year despite us increasing our revenue by 6%. And that is because we include all property in setting that tax rate and calculating the no new revenue rate. It's based on the entire taxable value. And historically, the property values in Travis County have been increasing quite dramatically. And the increase between 22 and 23 was so significant that in order to get to the same revenue in the prior year, it decreased the tax rate. That leveled off a little bit this year, and so the tax rate then has begun to tick back up. And so because of that, you see some fluctuation in the overall tax bill. But over the last 3 years, highlighted from 22 to 24, the actual payment has increased by about 4.5% per household. Next slide, please. And so we talked about growing and changing and being forward thinking. We decided upon this tax rate based upon our long-term planning, all the way through 2030 to implement our health equity plan. And there's a lot of projects involved in that. There's a lot of investment over the next 7 years. And in order for us to keep our sources and uses close and draw down those reserves in a responsible and sustainable way, we determined that that 6.5% year-over-year tax rate would be needed to support all of the efforts through the next 7 years. So we're looking forward to growing all of our services, and also we're wanting to maintain a certain reserve balance that's necessary to help us manage our risks. We have, as any organization does, we have risks that are financial. You've seen the inflation over the last few years that impacts us as well as individuals within Travis County. There's operational risks, and workforce is a big one, especially in healthcare with healthcare shortages across the country. So we have risks associated with being able to pay a competitive fair wage and attract the providers that we need in order to be able to implement our long-term health equity plan over the next 7 years. Next slide.
Can we pause just
Sure.
1 second and talk about reserves to make sure everybody
Yeah.
understands? When we talk about reserves, we essentially mean it's like a savings account for Central Health, correct? To plan for the future, but also to be prepared for the unknown. Could you explain that in more detail?
Yes, exactly. So over the past few years, we've actually been building up the reserves because we knew that we were going to begin implementing this healthcare equity plan. The plan was approved last year, and then we have dug in on the details and building out how do we operationalize that plan in order to fill the gaps that we identified within our healthcare system. And because we knew that work was coming, we held those reserves, essentially, like Ted just said, as a savings account in order to be able to spend down that money in the future years without having to raise taxes even more. And so you'll see, starting this year through 2030, we'll be spending more than we're bringing in tax revenue, but we're balancing that budget by using the reserves to pay for it. But we also can't spend all of those reserves because of those risks that I just mentioned. There are unknown things that could happen. The costs that we've projected out 7 years could rise dramatically. Any number of disasters could happen, and we need the ability to be able to respond quickly. And so that's what the base level of reserves that we'll maintain will be, what the purpose of them will be for.
So because we have these cash reserves, this is a balanced budget. Because we've been able to set aside money in our reserves, and risks that you mentioned, staffing would be a risk, correct? In a market like Austin, where hiring medical assistants, doctors, nurses, administrative staff can be very challenging because it is let's say, buyer's market. There are more jobs than there are employees. That's considered a risk, correct?
Yes, for sure. And we are, as part of this plan, one of the things that we are doing is engaging in partnerships with different community colleges to grow the workforce. We have next year program to hire some interns as they get their medical assistants certifications, and then hopefully then through that process we can bring on some full-time employees through this partnership.
Pipeline of doctors through our Dell Medical School partnership and that investment. Okay,
Exactly.
thank you.
Next slide, please. All right, now I will hand it off to Cynthia Gallegos.
Thank you, Kim, and good morning, everybody. I'm going to try and find my place. I apologize if I move around a little much, but I think this is my right space. Okay, so I'm going to kick us off talking a little bit about closing the gaps and really what that meant. As Kim and Mike alluded to earlier last year, Central Health took on an effort called the Healthcare Equity Plan, which was really our attempt to work within the community to get a community pulse check on what were the areas of need in the clinical services space. And as part of that, there were areas that we were able to identify gaps in. And you'll note here on this slide the 6 areas that were labeled with either a moderate gap or a significant gap. And let me define to you the moderate gap. So when we're talking about moderate gaps, we're talking about 30 to 50% of the community needs were not being met. As far as significant gaps, this is where we're talking about more than 50% of the community needs not being met. And so as I kind of speak to the next slides, it'll really help paint the picture of what we're doing about that, how we're working to close the gaps, and how we've started working to close the gaps this year, and we'll continue to close the gaps into the coming years, as Kim was mentioning.
When you talk about a significant gap, what does that mean for a patient? If there's an area that has a significant gap like dental care, what would that mean in the lives of our patients? Longer wait times, inability to access a doctor?
Absolutely. So what that translates to each of you all, and I imagine several of you all have experienced it, is longer wait times, having to wait several months to get in to see primary care provider, specialist, dental. So we're really focusing, and you'll see here, in those different areas to try and start solving and closing the gap for the population that we serve. Thank you for asking, Ted. Next slide, please. So direct healthcare services, I really like to preface this slide with trying to take a step back and make sure folks understand. We talk a lot about starting the direct practice space, and I share that because this is a new area for Central Health. Historically, Central Health has contracted for services across the community. That varied from primary care, specialty, urgent care, hospital services. And so as we enter into this new chapter of Central Health operations, we're really starting to invest a lot more in providing the services ourselves. And so as Mike was mentioning, we will be opening Rosewood Zaragoza Multi-Specialty Clinic in the fall, starting off with our East Clinic as a soft go live. And that's really us starting to put kind of pen to paper and action behind making this vision come to life and starting to close the gaps that you saw on the previous slide. And so this is where all of those ologies that Mike was mentioning will be coming to life, including cardiology, GI, neuro, nephrology, podiatry, and I missed one. I was practicing those. I really, 6 of them. I should make a song out of that. Did I say nephrology? So really excited about that. And as you can imagine, as a new as an organization entering into a new space, this is fundamentally a new area for us to have to get infrastructure in place in order to be successful. What do I mean by infrastructure? I mean, we need to be able to bring in the staff members. We need the appropriate licenses. We need to go procure the equipment. We need to make sure that we have all of the items laid out so that we can be successful for a go live in an area that we have not previously worked in. So outside of standing up Rosewood Zaragoza, we'll be moving into also creating programs. I don't know if complement is the right word, but basically extended programs, if you will, into the service lines that we will be pursuing. So for example, in our cardiology space, we will be providing a heart failure program, as well as in our nephrology space, we'll be having a renal failure, renal disease program. And this is really to ensure that for the more complex patients that we will be serving, that we're able to give them case management, education related to their chronic illness, and other necessary wraparound services to help set them up for success. This year, we also worked in transitions of care space. For those of you all that are not familiar with transitions of care, this is really us making sure that as patients are being discharged out of the hospital setting into a skilled nursing facility, into their home setting, or right back into a primary care office visit, that we help with those warm handoffs to ensure that those are successful and that they are not having to tell their story all over again, or not receiving gaps in that turnaround, therefore requiring them to go right back into the hospital. We put a lot of investment and time into building some of those teams this current year, and we'll continue to expand upon that so that we can reach additional hospitals, additional ED rooms, as well as additional skilled nursing facility sites, so that we can be ready to receive those patients. And we'll do so by adding some of those positions that you see listed. Medical respite was another area that we really started getting off the ground this current year, and we've done this for a couple of years now, related to contracting to have patients have access to this. Medical respite, for those of you all that may not be familiar with that, is really ensuring that for those patients experiencing homelessness, that they have an area that they can go and recover. What we were finding is that oftentimes patients were discharged to the streets, therefore they would end up right back into the hospital, not having the opportunity to recover fully like they may have needed. And so being able to provide medical respite ensures that they have a bed so that they can recover, and therefore then be able to transition out into the setting that they may have come from. And so what we're doing is that we have really invested in starting to build teams on the Central Health side so that we can start practicing and getting a little bit more exposure, so that come a couple of years from now, as we open our Cameron Center medical respite site, we will have learned a lot of the lessons, if you will, with our partners today to be successful in that space. This really includes having a community health worker, a provider, as well as a nurse and a medical assistant team, and really working to scale that across this next coming year. And then I spoke about the infrastructure earlier, but the electronic health record is another massive lift that our teams have undertaken. And really, if you are not familiar with that term, as a patient of community care, Peoples, or Lone Star, you may have heard of a mechanism called MyChart. It's your health record, right? And so as a group that has not historically practiced medicine, that is something that we have to be able to implement and make available for the patients that we will be serving. And then lastly, we talk a lot about making sure that we tend to the patients that we will be serving and making available services that remove barriers for them. And so we really take a step back and make sure that we will be able to offer transportation as well as translation services, so that the patients are really getting what they need out of those visits, and that they're able to make their visits as often as we can help them. Next slide. Yeah.
Questions
Absolutely.
from the room, but also on Facebook Live, and you may answer one of these questions. But one of the questions is, we plan to partner with other community groups, community programs. I know that we mentioned we have 228 provider locations throughout Travis County. We have extended partnerships, for example, last year with the Black Men's Health Clinic. But do you want to address that?
Happy to talk about that, and I know we have a slide coming up, but we will continue to partner with community organizations to provide services to our MAP and MAP Basic patients. Here shortly, you'll see that we're really excited to continue our expansion in the ENT space as well as audiology space. Just to give a couple of examples, we're actively also working to expand in the dialysis space, our transitional dialysis program. We're really hoping to continue that work within community partnerships.
Another question Question from Facebook Live is regarding hospice services. Can you talk a little bit about hospice services with Central Health?
Absolutely.
Also a partnership.
Yeah, so we partner with Hospice Austin here in Travis County to make hospice services available. And this is really for those individuals that may have, I believe it's 6 months or less to live, ensuring that the quality of life that they experience through those 6 months is at its best. Just to piggyback off of that, we also have a relationship with palliative care providers here in town, which is even more upstream, if you will, in a serious condition. And this is really ensuring that they are receiving the wraparound services and the support, as well as their family members, as they're dealing with somebody being diagnosed with a serious illness. No problem. Yes, ma'am.
I have a question. My name is Ophelia Zapata, and I'm community organizer and also a trustee. A new partner I'd like to bring to the table is AISD. We have a lot of our patients that come to our schools, and there's a disconnect in knowing what our students' health care is until there's something that happens, right? Something not good that happens. Then we find out, well, the student needs this and this. So if there's a way to build that kind of partnership. One. And number two, mental health is everybody's priority. But we need to put teeth into that. What's the action we can do as a collective group of governing bodies? The county has invested lots of money into that. The district is willing to do that. How do we all come together and really create something that's going to be effective and connected so that we don't double dip into this work? Yeah, and duplicate services, but it's something we have to do immediately, like yesterday. And I'll just let Ms. Emerson ask the other question.
We can talk about partnering with AISD. Alec Guetta is our outreach manager, and we can talk about that, and then Maria will take your question. Will that work?
Good morning. Yes, we do partner with AISD's Office of Parent Support Specialist. We attend their trainings and come to their meetings to talk to parents and families on site. And we're looking to deepen that partnership by helping them through the online application. Although there are many schools whose parent support specialists, I mean, they're superheroes. They go above and beyond, and they themselves have been helping submit those applications in a lot of cases.
I think I'm talking more about our nurses and our
medical partnership.
Good morning. My name is Maria Emerson. I'm a member of San Jose Catholic Church, Advocates for Social Justice Reform, and the Texas Anti-Poverty Project that Ophelia leads. One of the things I'd like to share a little bit of a personal thing that happened. I have a son. He's in his 30s now, but at age 15, my husband passed away. He was doing very well up until then. Then he slipped into deep depression, clinical depression, and anxiety. My insurance covered it until he became 26 years old. And then he was funded through your support. And so I'm very grateful for that. However, he went through integral care and received a lot of help. He was hospitalized and all of that. And he's doing very well now. But that's been like 20 years with a lot of attention to him. I retired early to take care of him. Anyhow, what I'm getting at is that I'd like to recommend, first of all, I'd like to commend Central Health for all the improvements and the great advancements that have taken place in healthcare for a lot of our community members. Mike has been a tremendous asset, all of you and the staff. But one thing that I find that I'd like to recommend in the Gap area is a long-term psychiatric hospital that y'all, I think, is the right time right now to consider, you know, developing, because like Ophelia said, there is a lot of concern over health care, finally, and I'm very happy about that. But yeah, mental health. And so we need to start working on that on a long-term basis. Thank you.
So I'm going to walk back over here to the other side of the room, and if you'll allow us to get through some of these slides, we'll come back to some of these questions. But the issue on the floor is, or two issues, is how is it that we can better partner with AISD, but also Del Valle ISD, and then on the mental behavioral health, while there has a lot that we have done and made a lot of advances, but you're pointing out, really, which is a much bigger vision of, okay, what are the, going beyond what we currently do today, what do the next steps look like? And so I've got those down, and we'll come back to those. Ms. Hardison, I saw you had your hand up. I think so. I can't. Yeah. Oh, I'm sorry. Let's get your microphone. Hang on just a second. Please.
Good morning. Where I work at, someone had called last week from one of the school systems, AISD or either Del Valle, and they had a question for a family student. They had a hotel voucher. The house had caught on fire, and they was trying to see if we could assist. I said, no, no, they was trying to get additional money for that. So my question is, like, where do the patient support services fall under to assist when things happen unexpected, someone having a crisis, or they're being displaced and other things come about financially that they didn't expect? And I was trying to understand the difference with the social worker and the community workers. What are their roles? How are they supposed to assist patients?
Yeah, good question.
That's a great question, and I don't want to try and speak out of my comfort zone, but I will tell you, as far as social worker and the community health worker responsibilities and how they will differ. But I will share with you that we're really looking to try and think through, at least on the social worker front, right, as we set up our clinic spaces, what questions we will be asking patients to help prompt and ensure that we are providing services for them as food insecurity may come up and or housing insecurity may come up, right? We want to make sure that as part of the care model that we are thinking through what happens when they say, I don't know where I'm going to be staying tonight, right? So that really eliminates what's in front of them for the office visit. And then not only when they say that, but what are we going to do behind the scenes rather than just mark a box, right? Like, we need to ensure that we have the tools, resources, pathways to get that patient the services that they need, so that they're accessing all of those services. And I'll share just a little extra detail before I pass it to Mike. Is that we are currently contracting with a vendor called Find Help, right? For those of y'all that may be familiar with the old Aunt Bertha. I don't know if Aunt Bertha. But basically, it's a local network of resources that our teams will have available. And once again, making sure that behind the scenes we have the staff to then go and deploy so that they can go and help those individuals and make sure they got the resource, not just check a box. Hopefully that provides a little bit of insight into what we're doing.
And if you'll keep going through the slides, Ms. Hardison, I'm going to come back to your question because there's some additional information that we can provide.
We have another question.
I'm sorry, I'm right here. My phone.
I'm just tapping onto what she just said. Because we've been having so many numerous fires and so many people have no place to go. The main thing is everything they own is getting burned up. Their wallets, everything, they have no ID. So if they were to come into one of your clinics and they don't have an ID available, can they get some help?
We will address that, absolutely. We have resources that we can speak to.
All right.
We can answer that question.
Yep.
Put it on the slide.
Hi. Yeah, I just wanted to add that currently, we do have community health workers that are working with our MAP members when they need additional resources beyond the MAP enrollment and the clinical appointment. They have been working in platforms like Aunt Bertha, Find Help, and Connect ATX. But it really is about getting the wraparound services for that community member beyond the clinical services sometimes.
So recognizing that if you just been through I like to talk about what I'm told and use the microphone. But recognizing that, let's just take that exact example. Everything you had is now vanished. It's gone. You don't have access to a computer. That's a stretch and a luxury. And so, for example, if you were to be able to get to here, or if we could get you some transportation assistance, then we have folks that can help work through that. It's not automatic. It's not just a flip of the switch. But if we can find some way to validate your identity, and this has happened before. I mean, we have, and absent even not having an apartment or a house fire where you're staying, people just lose their ID. And then, but being able to validate who you are and then get you connected to resources, as Cynthia and Sela have talked about, is something that we're doing today. It's not just plan vision for the future. That happens today. And I want to commend a lot of the folks on our, the care management teams that just figure out a way to get these things done. And there's a lot more that they've been able to accomplish probably than I'm able to give them credit for here today. But the short answer is, if we can meet you somewhere, where you are, or you can get to us, either way, we can work through that type of situation. Yeah.
All right, I'll pick back up on this slide. So as far as the healthcare operations and support, this is really where we're continuing to ensure that we kind of build that infrastructure that I was telling you, and how we're kind of proposing to do that. Sorry, I'm once again trying to find my spot. Is ensuring that we continue to expand the primary care space, the dental space, doing so with some of the new coming clinics, Del Valley and Hornsby Bend. We're also looking to expand on our eligibility and enrollment front. In doing so, really trying to expand virtually for those that are experiencing homelessness, as well as ensuring that we're able to put resources, eligibility resources in the new centers listed here, as well as Rosewood, Zaragoza. We will also be working and continue to work, because this was one of the heavier lifts this year, on the Central Health Navigation Center, and we've done so by really leveraging some of the existing infrastructure that the eligibility call center had up in place. This is the navigation center that will be taking in all of the calls and routing them to the appropriate setting. So you will be experiencing, like, scheduling will be happening here. We'll also have the enrollment happening in this area, as well as future televisits, and just really trying to create efficiency in our clinic settings by pushing out some of those calls that can be handled by some of the subject matter experts that could stand or be in this centralized location. We also continue to build on the technology infrastructure, and this is with the spirit of all of the new direct practice-like work that we will be pursuing. We need to ensure that we have the right securities in place, and that those securities are scalable for the additional initiatives that we will be taking up in the future. This is also helping ensure that we have the right analytics and reporting systems in place. Why does this matter? This is so that we can continue to track the health trends and make sure that we're able to really prove the outcomes, right, and track the outcomes and follow the trends so that we're able to continue providing services in needed areas. And then we will be continuing the Sendero ACA subsidy programs. Next slide. You want me to pause and ask if there's any questions related to that? Okay.
Hello, sir. Hello. Yeah, there should be some improvement in pharmacy, because nobody picks the phone. When you keep calling for hour and hour, days and days, nobody respond to you. If you record the message, nobody bother to listen that. So this, yeah, Yeah, and another thing that the waiting time, you already discussed that. My wife, she was referred by the doctor for nephrology, and we have got the time in July. We have got the time in November 28, after 5 months. And you have to suffer all the way for 5 months.
So, would you agree, and choose to answer this question or not, but would you agree that focusing on these gaps in specialty care and us getting, for the first time, directly involved in hiring the doctors to fill these gaps in care, directionally, does that seem right to you? Okay.
But you know, there should be some solution. If you don't have time, you can go to another clinic. These are the things which should be addressed. Yeah. For 6 months, it's a long time.
It's unacceptable.
Yeah. For your health, you have to wait for 6 months. You have something wrong with your, urinary system. You have to wait for the 6 months, and then it develops more.
And that's one of the, I'm sorry to keep yelling. Sorry, we got that one. So that's, our board will be looking at performance indicators and measures in September and then again in October. And I don't want to speak for the board. They've got their own votes, but it is actually getting to how quickly can we get access for our patients. And that's something that gets measured and gets put out there publicly so we can all see it and strive to meet or exceed that goal. Yeah.
You have to take action earliest.
Yeah, we agree. We agree. Yeah, let's come, yes, please.
I understand what he said about his wife, but your community is not the only community going through this. I am a veteran. Sometimes we have to wait a whole year to get back to the doctor that we need to see. No one should suffer, but we have to travel long distance to try to get to another doctor from Austin all the way to Temple or all the way to Belton or all the way down to Gatesville. So it looked like the whole community now is suffering for one another. So therefore we have to have patience, but not that much patience. And we have to be more demanding, because when your body gives down, you're not happy. And people cannot understand when you have a look on your face to say, get out of my way.
So we want to acknowledge, Lisa, hang on just a second. We want to acknowledge that, coming at this from looking at a harm reduction, but also trauma-informed approach, is that there's a lot of communities, whether that's by language or location or by race or ethnicity or gender identity or orientations, that folks suffer. And we absolutely create space so that people can come share their stories and what their sentiments are. And so I think this exchange right here was an example of that. But yes, don't have a whole lot of patience, and I think it keeps us, holds us accountable. But we just need to acknowledge here at Central Health that there's a lot of communities and a lot of people that identify in a bunch of different ways, and folks suffer. And that shouldn't be the case, and that's why part of this, the work that's been going on for the past 20 years to, as Maria pointed out, to bring on more services and to do more for more people to alleviate that suffering, or also, let's say, healthcare disparities. Let's use those terms together side by side, so that no matter how you identify, your health outcomes is absolutely the best that it could be, and that shouldn't be because of the color of your skin or where you live or how much money you have. We agree. Elisa, real quick. Let me come up. I'm coming to you. Hang on. Of course, I say that, yeah. Here you go. Thank you.
This is for the ones that I've encountered or heard of that need medical equipment. I don't know as I speak now, but Medicare stopped doing a lot of that. And so when we have a patient that needs medical equipment or assistive devices, that needs to be helpful for them. And also, the dental, more services need to be added, other than the little bit that they do. Because some years ago, I had to drive to UT Dental School in San Antonio for some services, and now I need some more services, and for dental, and community care does not cover them. That's been way overdue. And one more, like eyeglasses, eye care. It's about 3 or 4 places on that sheet or less that where you can go. It used to be a whole sheet and a half or almost 2 sheets. And I don't know why it pulled out, but we need that very badly, all of that.
Thank you. So the issue is medical equipment, eyeglasses, but also dental. And as we continue to expand locations, that's part of it. Now, I don't want to misrepresent to you, Ms. Artisan. It's going to be, it's not going to be overnight. But as, for example, Hornsby Bend comes online, then as we're able to provide more capacity, it's not just for the doctor's visits, it's absolutely for durable medical equipment. And I'm hesitant to talk, speak to eyeglasses and vision and ophthalmology because I think there's folks that really have a lot more information that really need to answer that question. There was something else you mentioned about dental chairs. We are going to be adding more dental capacity. We've already just recently, Community Care opened up a, with some of our support, a clinic at the Chalmers neighborhood community and added a significant number of dental chairs. And if you look at the different locations where we're bringing services online, especially in Del Valle, having more dental chairs added. And dental chairs means, again, additional, cleaning and hygiene, but also dental appointments for more complex procedures. So that's absolutely, yes, yeah, orthodontics, yes. So with that, Cynthia stood up and down several times. I think if you'll permit her to get through these slides, and we want to get back to your questions and what you're saying.
I just want to know, how are y'all going to educate the community with all this new stuff? I mean, I don't want it to happen that when I first found out that Community Care was down by HEB, where they inform us, because it was in the parent group, where there was a Community Care, there was eligible for everybody. So I went, and I was denied, I wasn't able to get seen. Well, this was years ago, but I just don't want it to happen to nobody. And so, I came back, and Ophelia was the one that gave me that information. I'm talking about years ago. And so I just don't want that to happen to nobody. And all this stuff y'all talking about is great, with new stuff, but how are we gonna get it out there? And I don't want it like it was done to me. I had to go through some stuff, but I just don't want nobody to go through what I went through. And one more thing about all this electronic everything. I'm old school. I love papers. Give me paper, don't send me all that stuff. I'm old school. I tell them, I need paper. I'd rather be paper than that. If they're worrying about cutting trees, go to my house and cut all the trees because I need my papers. Thank you.
Thank you, Esther. Hang on just a second. Let me come back to this. So, Esther, you're right. We don't want this to be by accident, and we don't want to impose on Cynthia or Maria or anybody else here to be the conveyors of that information. Now, we've got several people here in the room today that work in our communications and outreach program. Some of them are trying to exercise a lot of restraint because they want to come up here and grab the microphone and say, hey, guess what we're going to do? It's really cool. And yes, it is, but the one thing that we do is, yes, we put stuff out online, but because of the digital divide, not everybody has access to that. But also, Esther, it's about building, or in some cases, rebuilding trust. And you can't do that online. Now, you can call in to our offices, and we'll provide you information. Like if you enroll in MAP and you're wondering, where do I go to get care? What services are available to me? How do I activate this, especially if you're a first-time MAP user, or maybe you had MAP years ago and now all of a sudden you come into this whole new program and it's completely different from what you knew. But also we have community conversations, not unlike this one. And sometimes there are this many people that attend, sometimes there are 3, but whether there's 3 or 30, we provide the same level of information about what is happening in our care system, what we're challenged with and what we're having to overcome. And there's a lot of input that we seek when we actually, for example, around the Hornsby Bend Clinic, meeting with community members there in Hornsby Bend, asking them what's the best way to advertise and publicize this health and wellness center coming online. Because while there's a lot of great people in here that just have phenomenal ideas, and they've pulled off some stunts that I think deserve Oscar awards, or is it Oscars, or actually both, Oscars, Tonys, whatever it is that you can find out there on the shelf, just pull it off and hand it to them. But they will also tell you, to a person, if you're not connected to the communities where the services are being offered, about how you roll that information out, then we're back to you finding out accidentally, and that's not what we want.
Regarding how we get the word out, it is a comprehensive approach. So we don't just rely on social media or an email. We have people on the ground. So Mike mentioned the Hornsby Bend Clinic. We're going to be going door to door and handing out, I believe it's 9,000, somebody could correct me if I'm wrong, 9,000 households in that community, handing out information, inviting people to come to that health and wellness center, and community members to come tour it and see it. And as Mike mentioned, the advisory committee members who've been walking with us along this journey since the very beginning, helping decide what kind of programs should be offered there, what kind of public spaces should be included, what the art on the walls might look like. So we go from paper, which we have plenty of copies here if you didn't get one of today's presentation. We use every single tool that we can possibly use in our toolbox. So from the digital side, social media, website, email, radio, billboard, everything, but then also just those one-on-one relationships that Isela's team does, where, going to point of service events, meeting with people who are experiencing homelessness, getting them enrolled on the spot in MAP, going to community events, hosting events here. So we really do try to use every possible way. If somebody may never be on the internet, have no access to the internet, we're going to reach them somehow. People who are on the internet right now, some of you are, we're going to reach you as well. So we do try to use a comprehensive approach. Happy to share more information with you about that as well. And I do see your hand up. I'm coming to you next.
Is there any way where, when y'all have a meeting, not like this, because I know there's something else, but any other kind of meeting where you could invite the people that enroll you when you go and apply for Medicare or whatever it is, so we could need what is the qualification, because I know there's a lot of different stuff, so that would be very helpful, so that way we can know, more about.
Organizations represented, providing information, we do a lot of that, but yes, that's a great idea. Anything to add?
Yeah, well, I would add that Elizabeth,
Come on.
No, those are great points. I think we've gotten a lot better at communicating with folks. We have a lot of people that are out in the field. We recently did an access event in Hornsby Bend, just letting meet the teacher registration for Del Valle ISD, letting people know that the clinic is coming on board, what kind of things they want to see. People have a lot of ideas, and we want them to feel invested and to be a part for that clinic, that site, to be a part of that community. But what you're saying is true. A lot of people still like paper, so we make sure that we get that out as well.
Thank you. Do you have a question still? Pardon me. Thanks for your patience.
Hi, my name is Gabby. I'm actually not a patient, and this gets me very emotional. I'm a proxy from my grandmother. She's 97, and I hear every story, and it's very eye-opening. I don't have that problem. I have private health insurance. But my grandmother, she has a lot of disabilities. She can't hear, she can't see. And I'm gonna start with the positive things. Community care, I didn't know. I'm 100% agreeing with her, because she doesn't have me, there's no way she could see the Mobile Vision Center that you guys have it across the street from here. That was amazing. She just had her glasses. She's 97. She's blown away because she can see a little bit. The ophthalmologist, she was able to see her last week. But this just is happening. Like, she's been enrolled for 5 years. And yes, I can do everything through my phone, but the Zoom meetings that she gets, it's not happening. And she I've moved from New York City, so obviously it's different budgeting, different fundings, but because she can't speak the language, she can't hear, she doesn't have vision right now, a little bit. There was a lot of social workers coming into our house and I have a toddler, so I feel like having someone coming into your house and just like, is there anything that I can help you with? Or what are your questions? I didn't know about the vision. I didn't know about all the resources. Whatever you got, the lunches for the summer. I was blown away. I was picking up medication. I didn't know. My grandmother disappeared, and then someone grabbed her to the lunch, and I was like, thank you, but let me know next time. And, you know, she eats what I cook, but she was like, take me every day. And I'm like, I will take you. Yeah. You know, and like, those are little things that like the community, I love. I go to the library 4 times a week for my toddler, and that's where I found out too about the lunches. But it's not exposed enough. I feel like, you know, for people that have minorities like us, you know, and I don't have any of these issues, but like every single story like resonates with me. No, I'm like first generation American. So I don't have to deal with those problems. My grandmother and my mom does. So it really sucks. What if I'm not here? Like what if, and I'm sure there's a lot of people out there like that. They don't have a proxy. They don't have someone. I fight with everyone. Like, oh, you're not gonna answer the phone, then I go there. I come here because it's true. They don't answer the phones here. And sometimes I'm like, okay, let me try their Spanish because I'm fully bilingual. They can barely speak Spanish here. So like, it sucks that I'm like, okay, you know what? I'm gonna, because I don't think about those issues because I can resolve those issues for myself, for my grandmother. But what about the people that can't speak English? An 8-year-old is translating for them. That's not okay. So I feel like just having someone, I don't know, more fundings for social workers or someone that like will knock your door. Because yeah, not a lot of people do social media and things like that. I find everything out through social media, but that's not everyone's case. So I don't know, just be more mindful of who you hire. I don't know, like 85% of your population is Hispanic. So be mindful, you know, have more resources, be a little bit more outspoken, and, you know, like handing out papers is not enough. Just, I feel like doing a little bit more extra work would be it. So thank you for listening.
Thank you very much.
Sorry.
No, don't apologize. And what you pointed out is that it's, you know, yes, we have budgets and we have plans, and we put those together so that you can see what we're doing. But at the end of the day, you just pointed it out. It boils down to one simple question that you ask everybody that you interact with, whom you interact, which is, what do you need? Anybody can look at your charts and figure out what your blood pressure, your age, and what diagnosis you have. But at the end of the day, you still have to ask the question, what do you need? Otherwise, you haven't completed the patient experience. And it doesn't just stop in that one encounter there. There are, we've added a lot more resources over the years, and we've gotten to be able to connect with people that are on the other side of the digital divide. And it has nothing to do with not having a computer. To your point with your grandmother, it's those devices are not designed for people at her life stage right now. They're just not. And so what is it that we can do to connect? And I would like to visit with you more about this, and for those of you that have had some issues with getting through on the phones here, if you'll stick around a little bit afterwards, I'd like to know about that. We have some folks from Community Care here that I think can help us troubleshoot some of this. Also, I want to say this about Community Care. They're in the same boat that all healthcare providers across the nation are, in that we have workforce challenges. And it is, and I'm not trying to make excuses, but I'm saying here's what's happening. And I think that also they've got patient experience directors, like staff, that their full-time job is doing nothing but improving upon the patient experience. And so what your words matter to us. And over here I heard some yeses or some amens or maybe both. if you'll stick around and visit with us, so that way we can make sure that that information gets conveyed appropriately. Now I'm going to hand it back off, real quick. Thank you.
I just wanted to say thank you for your selfless feedback and for advocating for your neighbors. We have another gentleman that is here present that had a very similar comment around he can navigate the system, he can get loud on behalf of those that can't. And as hard as it can be to hear that feedback, it's very necessary. And thank you all for looking out for your neighbors. All right, so purchased healthcare services, and there were quite a lot of feedback around this, but we are continuing to look at expanding several bodies of work that we do with our partners, some of that being with community care and expanding their street medicine and mobile clinic for patients experiencing homelessness. We're also looking to partner with the county as well as Integral Care for diversion services. And for those of you that don't know what that is, that's really creating a center for those that are experiencing a mental health crisis. And rather than those patients ending up in the jail, giving them an area where they can receive support services as they go through that. I mentioned earlier medical respite contracts, continuing to expand that to gain additional beds. And then really working our way or continuing to work our way into substance use disorders with our partners. This is ensuring that we partner for some treatment beds this next coming year, as well as expand some of our methadone agreements that we have with some community partners. And then on the primary care and specialty care expanded care front, you know, I did want to acknowledge a comment around, we've done so much expansion and we've got so many services available to our patients, and we continue to work on our dental space. You know, I heard the comment around crowns, right? And this year we're looking to start understanding kind of how do we even play with endodontics, I think is really what you were referring to, and how do we salvage some teeth and how do we go about creating criteria around that, as you know, that's a new area for us to explore. I mentioned earlier that we're looking to continue expanding in our ENT space, our audiology space, as well as our transitional dialysis space, but a lot of really great work, and we just need to make sure that we're working on ensuring that those of you all that are in need of the services hear about them, and that we inform our team and empower them to carry this information with them so that we get the word out. Next slide. And then on the administration front, this is really going back to making sure that we create robust wraparound services on the administration front. We've worked on building our compliance program for Central Health, as well as, I think Kim mentioned this earlier, we're working to really try and see how we can grow our talent. We're starting with the medical assistants as well as community health workers, and we're looking to have, I think it's internship programs for those, so that we can really grow our talent and hopefully spread them across the community to serve the greater purpose. And then for expanding the finance, procurement, and human resource teams, as you can imagine, for an organization that scales as quickly as we're planning to, really making sure that we have that infrastructure to procure the equipment that we need as fast as we can, to make sure that we are hiring the staff and staying pretty competitive. All of that takes a lot of effort, and so really making sure that we I guess provide them the support that they need to scale their teams as we continue to grow. And then I think I get to pass it on to the next slide. You're going to take the next slide.
So we'll take more questions in a second, but just to give you a bird's eye view of this whole budget process, and we know that we have put a lot of information in front of you today. This isn't the end of this conversation. We have a Board of Managers meeting on August 23rd, which is this Wednesday, which I believe is also, is that right? Sorry, I'm a week behind, y'all. It has been a long week. I apologize. August 30th is this Wednesday. That is the public hearing. I mentioned that at the beginning. Everybody is invited to come provide comment. You can either do that at our headquarters at the Cesar Chavez location. It's Cesar Chavez and I-35 in our boardroom, or you can make that comment virtually if you just want to dial in via Zoom. And then on September 6th, our Board of Managers, one of our Board of Managers is here, Cynthia Valadez. They will vote on our budget and tax rate and hopefully adopt our budget and tax rate. Then we go back to Travis County Commissioners. Ultimately, on the 19th of September, Travis County Commissioners will vote on our budget and tax rate. You're also invited to come to that meeting, and we can send out information, but you're invited to come let them hear your thoughts and feelings on our budget and the priorities that we've laid out for you here today. Before we take questions in the room, we do have folks watching on Facebook. There have been some questions that we just can't answer live, but we do commit to take all of the questions, as we always do. We'll answer those questions and share them with you and with those who aren't in the room today. Would also like to say, go to our website. If you have access to a website, centralhealth.net, this information and a lot more is available to you there. You can go to our budget and finance section, find lots of information, backup, and if you would like someone to answer some questions, our contact information is there. We're happy to answer questions. We understand this is complex. We want to make it as easy and understandable for you as we possibly can, so we're here to help. And with that, I'd like to just open it up for any questions that we have in the room. Mike, we're going to say something?
Yeah, I'd like to go back and address some of the questions that were asked previously. I see your hand is up. We'll just let me get to some of these questions that were asked earlier, and then we'll start circling back around the room. So on the issue of working with the school districts, and I'm going to open that up. It was really around Austin Independent School District, but opening up to all school districts in Travis County. So think Del Valle, I think Pflugerville, Manor, others. And specifically, what Ophelia was referencing was the talent pipeline. So that's been fits and starts for us, to be perfectly honest about it. And a lot of this was due to COVID interruptions. And like a lot of things post-COVID pandemic, even though we're a year and a half or so past that time, it's been difficult to get it restarted. That's the first thing. Not that it can't be restarted. I'm just saying we have challenges there. Second thing is, because we're getting involved in the direct provision of health care, we've really been focused on hiring the clinical teams and all the necessary operations and support to provide more specialty care, because there's not enough specialty care capacity in this county. And it's hiring folks that have experience, but also the necessary credentials. And it's not just doctors, it's nurses, it's medical assistants, it's other technicians, if you will, that are absolutely necessary. Now, third thing is, and this goes all the way up to our chief medical officer, we've been discussing, and Cynthia mentioned this, working with Austin Community College. Recently, we've had some discussions at a community conversation, in fact, with Houston Tillotson. Of course, we've got partnerships with the University of Texas as well. But really restarting those conversations, and that's where I feel like a lot of the high schools that have health and health sciences and allied health programs, because you have to have some place for folks to go when they graduate, or when they get to the point where they can pursue certificates, even if doesn't involve a college degree. And this is important to remember and tell if you've got high schoolers, or you have high schoolers in your orbit, tell them this. It's not about just getting a college degree, although that is important. There are a lot of things that you can do in the healthcare profession and be a very important part of the healthcare team with certain certifications that you can get outside of a college degree. And that is so important to us. So there's a lot that we have to do on this, and a lot of moving parts, but quite frankly, you're right, it needs to be jump-started in a way that gives everybody all, that career projection, not just, hey, go through this program and get the certificate. Also, mental behavioral health came up. And what we've been doing over the past few years, and will continue to do more so, is integrate mental behavioral health as part of the primary care experience. For too long in the United States and other countries as well, you had primary care, you had specialty care, and you had dental, and you had mental behavioral health, and it was as if none of these things were all embodied in one body for whatever reason. That's just how we thought about it, and that's not right. So what we're doing is we're reversing that, and we're saying, and we've been doing this, mental behavioral health, including certain levels of substance use disorders, need to be part of the primary care experience. And so we've been doing that, thankfully, predominantly through our partners here at Community Care, but also Integral Care and others, that we're going to continue to work through that and do more. Now, then the issue becomes, well, what if I or somebody around me has serious and persistent mental illness? So think severe schizophrenia, for example, and the primary care setting just isn't the right setting. Well, we have contracts right now where in 4, maybe 5 hospitals working through Integral Care, last year alone, I believe we were able to fund over 1,900 what they call bed days, which is a count, if you will, for persons experiencing serious mental illness that needed hospitalization, and the follow-up care that goes along with that. And I heard hospital, psychiatric hospital, but that is bold, and I think these are the discussions the Board of Managers, as they get through this budget season, have indicated that we need to hurry up and get around that corner of the budget and start having conversations around what does the hospital footprint look like in Travis County. And I think it's just a matter of not long time, but short time before that starts to take place. There's a reason why the Board of Managers and we move forward with the Travis County Commissioners Court support on the Cameron Road facility purchase, which is it's over there at Cameron Road and 183. It's 3 office buildings and some land and some parking that we need to renovate, because we're going to be providing respite care that has attached with that mental and behavioral health and what I would say low acuity or low level detox attached to it. But that's the beginnings of having more facilities to address the mental behavioral health crisis that exists in America today. Yeah. So I think there's another question that was on Facebook Live, and then I'm going to be quiet and hand it back to you all. Is the issue of compensation, about how we compensate staff, particularly it was on executive level staff. As you saw on one of the slides, we actually have our salaries and benefits so everybody can see those. Our benefits are about, and it's not unlike any other organization that provides health care benefits, dental and so forth, it's about 30%. So if you take the salary, multiply that times 30%, or 1.3, check my Aggie math on this, that gets you to that salary and benefits number. Now, the board sets the compensation philosophy, and the philosophy is we price to a percentage of market, not 100% of market, but some percentage of market, so that way we can be competitive and hire folks that can provide, if it's on the clinical side, culturally affirming care, or if it's quasi-government people like myself that are needed to help facilitate and administer the affairs of the district. And so that compensation philosophy is set by the board, and it prices to a percentage of market, and and that same philosophy applies to everybody across the board, regardless of what level of in the organization you are, or whether you just joined Central Health yesterday or today's your first day. So, and there was another question around litigation that we're not in a position, as Ted said, to respond to right now. But we'll do our best to try to respond to it afterwards. But again, we're going to follow the advice of our legal counsel in doing so, and we appreciate your forbearance on that.
I would just say regarding the litigation, you can go to healthcarejusticefortraviscounty.org and learn more about the litigation. Again, it's healthcarejusticefortraviscounty.org, and you'll find information there that may answer some of your questions. Do we have any questions, any more additional questions or comments in the room?
Okay, I forgot. Let me see. Time out. With that, let's see. I know I had it, but my back is hurting. I'm sorry. With that reserve money, is there any way that y'all could also do classes for computer for those that don't know? Because I know maybe it's going to be, that we're going to have to, is it on or not? But I would like to know, even though I'm hard-headed, because that's why my kids don't teach me, because they said I'm hard-headed because they all tried. But is there any way that y'all could put that in there, so we could learn? Yeah, but I'm talking about here.
Yes, we need to get together and compare parenting notes, you don't mind. So the question is, are there ways to put funds in the budget to offer computer classes? I'll answer this as best I can, because it's not a straight up yes or no. So in this room that we are in today, this is a community room. And there's a lot of different things that happen here. Exercise classes, just on the other side of these two walls, cooking classes for those that are, yes. And, you know, where nutrition and diet is an issue, and so you want to make sure that people have options to have, you know, good tasting food. And so there's different things that we can do within these spaces. Now, at the health and wellness centers that are coming online, we have similar community rooms, different sizing, because this was for those of you that remember, this was the VA center, so this was already a built-in big place. But within those resource centers, there are ways to offer those courses. Now, will Central Health be teaching the computer courses? No. So it would be up to the organizations and working with the community to see what is it that we need to be bringing online. Now, we will also have, and I don't remember the number of terminals, but as part of our resource centers, terminals where if people need to utilize computers and of course need a little assistance, I know I do, working through, you know, maybe it could be a type of enrollment, it could be communicating with another non-medical provider for certain social service. So, but I know that space is going to be available to do that. I just don't recall how many terminals will be in these resource centers. But that has nothing to do with the reserves. Those are things that are planned on the books right now or happening right here today at Southeast Health and Wellness. Yes, ma'am.
Everything is so computerized now. We have a partnership with Austin Freenet, and they've been coming out doing one-on-one trainings and signing people up for free internet service if they qualify and things like that, but they're looking at having a class. So you come out quite a bit. So we'll put that, we'll post that when we have those classes. She did say somebody named Esther was not allowed to sign up. No, I'm just kidding. I also want to put a plug in for MyChart. I don't know if you guys have heard of this. I'm hearing that a lot of people are struggling trying to call the clinic and not getting the phones answered. I know that their navigation center, Community Cares, is super busy. They have staff that helps people sign up for MyChart. That way people can do simple things on their phone, like canceling an appointment or making one or asking a question to their nurse or doctor. So I really encourage you, if you're struggling with that, to have them walk you through how to access that kind of information on your phone. That's called MyChart.
While you have the mic, do you want to talk about the other health and wellness services that'll be happening at Hornsby Bend and ultimately Del Valle?
Yes, so we work a lot with the social service partners in the area, and for Hornsby Bend, because we've gotten such high feedback, people are really excited about us being out there. There really hasn't been a lot of community locations where people can do different things that impact their health. We plan on having Central Texas Food Bank come out there. Foundation Communities wants to come out there and have space to help people with their taxes. One of the things we've met with quite a number of elderly population in the Hornsby Bend area, and they want to start a walking group in the mornings, and we'd be happy to facilitate that. Hornsby Bend is going to have a great walking trail there, so I think that'll be a good way for people to find out what other kind of activities here. I mean, you come to our cooking classes, we're hoping to have some things out there for that community that really struggles going out to Southeast, or the other locations are difficult for them. So I think we're going to have a lot of stuff. Of course, we're going to tailor it to what people are looking for out there and what kind of things they want to see. So we have heard about the computer access issues and things like that. So we definitely are going to have 4 public computers at the Hornsby Bend Health and Wellness Center site that people can access and print things and do their online applications there.
Sure. Hi. How are you?
Hi. Good. My name's Leah, and I'm one of my thoughts on this budget is that there's a looks great. There's a lot more money for direct healthcare services, but if there's difficulty in finding even somebody to contract with, is there really capacity to reach this budget, or is it really kind of an overpromise? Because it looks good, and I'm assuming you're bringing it in-house, so there's more control over those services that are provided. So that was one, and my other question is, to what extent is inflation part of this, so that you're not really increasing the number of doctors or nurses or whatever, but you're just trying to keep up with the inflation factor? Can you address that, maybe?
Yes, and actually, since Lisa, you had your hand up,
Yes.
and we'll come back to your question, but I've got.
It's the area in Springdale Shopping Center where it's a facility for pregnant women. But years ago, it was another facility before Community Care and Central Health became involved in Springdale Shopping Center for health care. And they moved it, they built over there on Breaker. And so, if I'm not mistaken, over there by Main Road, all the way to Ed Bluestein, 969 MLK, they have to go so far away for health care. It's like, what about the area?
It's like 10 miles they have to.
So they need a medium meat right there. Put something in that area. You have to go so far. And another thing, I know during the pandemic, it was a lot of flack. You're trying to get appointments and stuff like that. You couldn't get through. Nobody would answer the phone, and ring, ring, rings, be on hold all day long and doing other stuff. And so I got past that and started going in person to the desk. And then the ones that's there, they're so rude and disrespectful because they don't have a supervisor breathing down their back. And I say, look, don't be rude to me, you know. And I find out who's over their head, and then they get a slap on the wrist. They don't do nothing about it. They need to be replaced if they can't be respectful and do their job. And I hadn't mentioned this before. I had not, I'm trying to say, but I'm bringing it to the front burner. Nothing needs to be left out. And when you go to the desk at the clinics, you're real skeptical how is it going to jump off. And I don't disrespect anybody, and I don't need them babies, wherever they are, at the desk that's hired to not be respectful or do their job. And you don't need nobody breathing down your back. Just do your job. That's all you need to do. And I don't mean to sound fussy, but thinking about it angers me.
What she's speaking of is very rightful. I live in that community, and the only thing they have over there is take care of the pregnant women. But in the last 6 months, they have taken away a lot of the bus stops up that way. And surprisingly, they told us that the electric train is going to come down that way. Well, we don't need an electric train if you're sick, because you're trying to get to a doctor. In that area, if you want to be seen, you have to go all the way downtown to Dale Seaton after 4 o'clock in the evening. I was not sick, but I just went there like I was sick. I sat up there for 7 hours before I was registered. My name was asked. There is no way for you to buy even a drink of water or anything once you get in there. So you can imagine when someone goes there and they're highly sick, if they don't bring their food with them, they cannot get anything to eat until they leave there. But they need more medical care in that area.
It's like old Breckenridge back in the day.
Slide by.
So we'll jump around and address those issues. So very well aware. In fact, when I first came on board, Manager Valdez, I think that's the first conversation we had was about Springdale. And yeah.
And I rode the bus, and it took me almost 3 hours to get from that area out to the new clinic.
It took me 3 years to get 2 bus stops, because I'm not from here, down on Main Road. And at the end of a year and a half, they took those 2 bus stops away. So our college students and high school students have to walk a distance by the time they get to school. If their body is not worn down and they're sick of something and they're not given permission to go see the nurse because they don't feel good, that child is suffering all day long.
So here's what I'm going to commit to doing. And we put these calendar dates up here, and I'm not sure which one. If it's not this date, I'm going to aim for this date right here, September the 6th, is to go back to our partners, because we don't directly provide women's reproductive health and OBGYN provide. We reimburse other providers for those services. But what I want to find out is, just based on what you and Elisa were saying, is what is it that's on the drawing board in terms of where we locate these services? I know they're being provided, but to your point, if they're not in a right part of town and women can't have access to those appointments, and there's a lot of barriers, then that's a risk of care not happening. And so I owe you a better answer. But what I'd like to do, if those of you that are kind of listening and taking notes right now on the Central Health side, I would like to come back and speak to this here on this September 6th date, which is going to require us to reach out to some of our providers that are providing this care that we're reimbursing to get you a better answer. Because right now I don't have a good one for you, to be perfectly honest with you. On the front desk interactions, I'll just say this across the board: there's no place for rudeness, ever. Even if somebody on the patient side of the desk, if you will, and I don't like that we have desks, but it's like, where are you going to put the computer? And so, but I think even if that patient has had their worst absolute day or week or year or an entire life, you're right, nobody deserves that, ever. And this is something that I mentioned earlier. There are patient experience folks that we reach out to, and I'll give you an example. There was, and I want to applaud Community Care for making this investment in the experience. So there was one clinic, and there was an issue. Again, it was front desk, and the patient experience coordinator goes out, spends a few hours monitoring this and taking notes, and then assessing what was happening. And then they go back to the clinic director, not just the supervisor, but to the clinic director, and say, look, these are the improvements that we need to make. And I'll give you an exact example. So there were 3 check-in windows, and the one closest to the door had the longest line. Well, what happens when we all stand in line for too long a time? It starts to wear on us. And by the time we get to that window or that desk or that space, it's not always going to be a good scene. And so, all right, well, let's fix that problem. That's easy. Let's have somebody that's out there, one, welcoming people as they come in and say, hey, could I get you to stand over here? Can I get you to stand in this line? And you'll see Elizabeth and her team doing that at these, and Elizabeth's over there like, yep, I do that, yeah. She does, at our resource fairs, to make sure lines don't get too stacked up. And so those are just simple things that I think that can be done, and Community Care has people that get into that level of detail. But as I mentioned before when Gabby was speaking, if there's some other access issues that you'd like to hang around or willing to share with me, I'd like to know more about that. Yes, and then I'm going to come back to Leah's question. Yeah, go ahead.
The security, y'all need to check them over there on Breaker. This was over a mask. This before the pandemic kind of let up a little bit. And right there on Breaker, the little desk shape like that, he had a bunch of masks sitting right there. And I'm allergic to the blues. So I asked him
Not uncommon.
for several so I can take them home because people were at my house. And I don't need no flu, okay, now with my system. And no, you have one now, and So Brian Thomas, I got a connection with him, and I got him down there. I said, I don't know what you need to do, but you need to get rid of him. And see, I used to do security, okay? And I know how they go. But you're not gonna, that mask not coming out of his pocket. So he was very stringent and rude about it. we went in the little pharmacy right there, and we talked, I explained everything to him, and I had just spoke to him about something else. Because I'm not gonna be quiet, a closed mouth won't get fed when you run. So, I say maybe y'all need to change the security you're using at our universities to get somebody else if they can't be mindful of their job. Because before the pandemic, I worked over there on South First, I worked with House Original and any of the others. And they enjoy what I've done. So I know how they go. So I can't speak on that. I did the security before the pandemic hit, so. They need to be checked or be monitored closely.
Treat others as you would want to be treated. Yeah. Okay. Yeah. Thank you. Thank you. Let's come back to the budget. That is a very astute question, and thank you. I'm going to start out by answering this, and I'm sure other people are going to come up and grab this microphone and provide more details, and they should, because it's kind of a lengthy answer, so I want to apologize in advance. So when we contract for healthcare services, we usually set them as a not-to-exceed amount, and so it could be $300,000, it could be tens of millions of dollars, with a bunch of subcaps underneath all of that. And it's based in large part on not just the number of people we enroll, but what we think the utilization will be. Now, right now, this is held up for the most part across the year. So for all the folks that we enroll throughout the year, you have utilization, and it varies from area to area around Travis County, but we have utilization that's somewhere between 55 and 60%, closer to 50%. But just because there was lower than expected utilization in one year, we don't go back to that contract and automatically just knock that down, knowing you could get to that, you could get beyond 60% utilization. And that's about, you hear us talk about sustainability. That's so that whenever we stand up a service and we put a provider out there, we know that the capacity is there. So now having said that, from time to time, those contracts are adjusted. And so if it's, and I'm just hypothetically making this up, but if they, let's just say one of their providers retires and so they scale back the practice, then yes, we would go in and adjust that contract down. Is inflation a factor? Well, I'm sorry, let me cut to the chase here. You said, is this, I think you asked, is it a true budget? Or is it something that can be attained? Yes. We believe that it is. So that graph that you saw with those number of primary care encounters and all that entails, as well as the number of patients, we believe that it is. But we also make certain that if we miss the mark, that providers don't call us up and say, well, we're not going to see any more patients this year. We're done. We don't ever want that to happen. It's bad enough when it's hard to get new patient establishment appointments, and you're looking months out for certain specialty care appointments. So, we believe that it is, but again, being cautious to make sure that we're always going to be there for our parents. Our parents. Yes, we're here for our parents and our patients as well. Thank you, Gabby. Now, inflation, you ask if inflation is a factor. It is absolutely a factor. So not only do we have consumer price index inflation, like what we see with, when we purchase office supplies or whatever, but we have medical inflation, which is significantly higher given the cost to deliver care and also some of the workforce challenges. And so that is absolutely sitting behind this budget. So with that, I'm going to ask if there's anybody else that wants to comment on that. Hang on, let me get an answer to here, and I'll come back over here. Is that directionally? Okay. Anything else to add on that?
I mean, probably too much detail, but the only detail I'll add behind that is, we have to stay pretty flexible with our partners, right? Like, I think that there's just a lot of, fluidness happening on their end, and I think I'm grateful to have some of that buffer, if you will, to allow for us to act when they have additional capacity, right, in an area that we didn't know but we've always needed, or if they've been able to, I guess they need help with, like, I'm trying to think what other good example there might be, but I will say that.
To take root. I'm thinking about the dialysis
That's
program
right.
too. We know we want to scale that up fast, and so yes, we're going to have that capacity in there. We're not going to artificially suppress that dollar amount based on what happened last year, because we want to be able to scale up dialysis for folks.
Yeah.
Thought I saw some hands maybe go up. Maria, and then
Yes, as a member of Advocates for Social Justice Reform, we are working on a diversion center. And the diversion center addresses, instead of incarceration, it would then treat people who have a substance use problem or alcohol problem. And 40% of those that are incarcerated currently have mental health issues as well. So many of them self-medicate with these other things. And so I'm just asking for your support in a diversion center rather than incarceration. Thank you.
I'll come back to this. Esther, let's get your question.
I have a comment on these two young ladies, the one with the red and white blue and the young one with the white shirt, what they were saying. I had experienced something like that one year. I was at the doctor's office and the nurse comes and gives you, the paper of what you were, what you went in there for. And I was in the right, so my friend was in there with me. And so I was telling the lady, asked the nurse, so is there a phone number where I could call so-and-so, And she threw me the paper on the bed. And I thought she was playing. We looked at each other, I'm like, I said, did she just do that? And back then I was like you, I don't want nobody to get fired because that family has, that person has a family or something. But what I want to know is, do they get training, or do y'all got staff meeting or something? Because I went out that hallway yelling and screaming, and that I didn't want to see that nurse again. And somebody grabbed me and told me, come and talk to me. But I couldn't talk to that lady because I had a right, because my friend got so scared and she went to the car. And, since I was in a right, I had to leave. But I was very upset. And that's the reason I know that lady next door that does the nutrition health class. So yes, and she remembers that. But yes, I don't want nobody fired. I want either training or, these people, because that's not fair. I'm a human being just like she is or he is, and I like to be treated like that.
Thank you. We agree, Esther. So I do know that community care does provide training, and it's not just the technical aspect of what do you do when you come to work every day, but it is also on how is it that we engage with patients and that patient experience. And so it's not just what I was saying earlier, which is, hey, if there's a complaint or an issue, there's a means to actually come back and address that. It happens, as people come on board in community care, and that's something that, and a lot of that training actually happens right here at this facility, as well as other facilities around town. Now, when we come back and talk about this, the slide went away. When we come back and talk about it on the 6th, I'll make sure that we have more information that we address and get it out there in the public. Yeah.
We're having a lot of problems here in the United States. I'm one that I can proudly say I have lived in 7 different countries. During Desert Storm, I was in charge of the Red Cross of 3 military bases. And if you think that was not a problem, 3 military bases, I only had 1 paid staff. I was giving birthday parties to people that I didn't know if their birthday or not, just so they could become my volunteer. So I gained 390 volunteers in 1 year time just to help me out during the war. And things were real bad then because all of our doctors were at war, and I had the dependents and the children to take care of. Some of them I had to fly back here to the United States. Some I had to come back with them. So we're having almost the same problem here in the United States that I have seen while we've been abroad. In Japan, during Vietnam War, it was horrible. I flew from Germany straight to Japan with 2 babies and pregnant. And there was not a doctor when I got ready to have my baby. I had my baby in the housing area. But I survived because I had a job to do. I was part of the military at that time.
Yeah, thank you for your service. Absolutely, please, thank you. And at a time when obviously resources just weren't what they needed to be, and what you did was just that account right there is phenomenal. You do what you got to do when you can, where you can, how you can. Coming back to the Diversion and Deflection Center, and I think this is my cue that we're ready to wrap up. That's actually been not just mentioned, but we're actively working with our partners to see what that looks like. And it's on the healthcare side, and it's making sure that folks that if we can, and we use diversion and deflection, because I think they're still trying to figure out what does the actual model look like. But our piece of this is setting aside funds, which we've done to make sure that people get the mental behavioral health, substance use disorder, physical medicine, dental, and then all the support services that are necessary, so that folks that, if we can keep them from becoming involved with the criminal justice system and live a better life, and it's because of their health status that has caused this situation, then absolutely we want to be part of that. So thank you. Okay.
Thank you, everybody. For those of you on Facebook Live, we are capturing your questions. We will answer those questions as well as the questions in the room and publish those. I also want to thank our translation services, so our Spanish language translation services and our ASL translators. They're really working hard to make sure everybody captures the information, and so we're deeply grateful. And all of my colleagues, the folks behind the scenes who've been broadcasting this on Facebook Live and put the meeting together and ordered breakfast tacos and just made it happen. We are really grateful that you could be here with us. We appreciate it. This is not the end of the conversation. It's just the beginning. And if you can join us on Wednesday, August, what is it? Good job. I learned as well. August 30th, the public hearing, we'd appreciate that as well. This coming Wednesday, August 30th. So it's almost fall. It might be 107 degrees on Wednesday. So it's at 5 o'clock. The public hearing is at 5 o'clock. So thanks so much. We appreciate it. Have a good day, everybody.